Hey, good morning, everyone, and welcome to Euronurse. I'm your host, Vic Sinise. Glad to have you on board. Hey, we're getting close to Christmas. It's almost here. We got a great show for you today, and let's kind of go through some of that with you right now. So let's see here. If you're new to the show, be sure to check out our website at Euronurse to find euronurse.com to find out more about the show. Best place to go to learn more about the show. Best place to see all of our previous episodes. Also, best place if you want to listen to us in your car to get the audio podcast connection. Just go right over there. It'll get you right into your audio podcast connection. So today, a little unusual, schedule change. We had today's schedule. Our speaker, Dr. Naraja Surawansky, had to undergo an emergency procedure yesterday, and unfortunately, is going to be unable to present. Now, hopefully, we'll have Lori joining me to kind of help run some of the questions and answers. She was having some trouble disconnecting this morning. That's why we got a little bit of a late start, but we'll see if we can get her on. But thankfully, one of the benefits of having 5 podcasts is you can sometimes rely on the other podcasters to help you out. So Dr. Jeff Albaugh and Dr. Lisa Pear did a presentation on this very subject a while back. So they're going to be stepping in to cover the topic. So we're grateful to have their expertise and insight and have them present in their place. So we're going to go right into that right now because I don't see Lori showing up yet, but hopefully we'll get her on soon. For the questions, feel free to put any questions into the discussion, into the comments, or if you just got some general comments you want to share, go right ahead and do those. But let's get today's session going.
Today, we are shedding light on a topic that affects so many women, yet it often goes unspoken. We're going to be talking about pelvic floor issues, pelvic floor prolapse, and how these conditions impact intimacy. The pelvic floor plays a critical role in sexual function, bladder and bowel control, and overall pelvic support. And we've had previous episodes with a pelvic floor physical therapist and some others. So this is a topic we are bringing to you because it's so important. When things aren't functioning well, whether due to childbirth, aging, surgery, or other factors, women may experience discomfort, prolapse, or loss of connection with their bodies. This can have a profound impact not only on physical well-being, but also on confidence, on intimacy, and on relationships. Well, the good news is you are not alone, and there's help. In this episode, we'll explore what's really going on and why it matters and what options are available to support healing and reclaiming pleasure and connection. I'm really excited about my guest this evening. Dr. Lisa Pear obtained her Women's Health Nurse Practitioner certification in 1992 when there were only 302 nurse practitioners in the state of Alabama. Now there are over 8,000. Wow. She obtained her Doctor of Nursing practice in 2018 and is a Fauna Fellow, and that is with the Society of Urologic Nurses and Associates. She has spent the majority of her career, over 25 years, caring for women across the lifespan, and particularly women with pelvic floor disorders. She worked for over 20 years with the University of Alabama at Birmingham, Kirkland Clinic, for the Department of Obstetrics and Gynecology, Division of Urogynecology and Reconstructive Pelvic Surgery. She's currently faculty at the University of Alabama at Birmingham School of Nursing, teaching in the graduate program, and continues a faculty clinical practice as well. So let's begin this important conversation, and welcome to Dr. Lisa Pear.
Good evening. Can y'all hear me?
I can hear you perfectly. Can you hear me?
I can hear you perfectly.
Hey, we got our technical things worked out perfectly. That's awesome. I'm so glad you can hear me on the video now. That's excellent. So thank you so much, listeners. If you were waiting for us, we were having a little sound problem, but it's going to be well worth the wait because there's so much good information to unpack. So Lisa, thank you so much for being here and joining us and sharing your expertise.
My pleasure. My pleasure. After spending over 20 years caring for women, to me, I want them to know they're not alone, and that there is things that can help.
Absolutely. Well, with that, let's get your presentation pulled off, and it's all yours.
Okay, so of course, you cannot be an educator without having objectives. So, I want to just do a little bit of, and I hear that there has already been presentations on pelvic floor dysfunction, and my focus will be on some of this, but mainly as it relates to pelvic organ prolapse that women experience. So, we're going to define the pelvic floor and its role in sexual health, arousal, and physical comfort during intimacy. We're going to define common types of pelvic floor dysfunction, but mainly focus the majority on prolapse. Describe how pelvic floor dysfunction can affect intimacy, including physical pleasure, emotional connection, and relationship dynamics. We want to recognize early signs and symptoms that we as women may experience that address both the physical and the emotional aspects of pelvic health. And then, of course, promoting open communication with your partner is so important. Even with your healthcare providers, because if we don't tell them we have an issue, it's hard for them to help us. And then I do have some resources that will hopefully help you as you work through this health problem. So as far as the pelvic floor, you can see all from this slide, we've got our bladder, our reproductive system. Are y'all able to see my pointer at all? Probably not. But anyhow, when we think about intimacy, pleasure, and connection, we often focus on emotions, communication, or even hormones. But there's a powerful, often overlooked part of the body that plays a central role in all of these experiences, and that's our pelvic floor. It's a group of muscles that support our core, and the little purple is kind of a overall view of our pelvic support. It controls our bladder, our bowels, and it's deeply involved in sexual function. Yet when something goes wrong, when these muscles are either too tight or too weak, or they're not coordinating properly, as women, we can experience pain, we can experience discomfort, and even a sense of disconnection from our bodies and from our partners. Today, we're going to unpack what pelvic floor dysfunction really is and how it can quietly but profoundly affect intimacy and pleasure. And most importantly, what in the world can we do about it? Whether you're experiencing symptoms yourself or you're supporting someone who has a pelvic floor issue, this conversation is about reclaiming comfort, confidence, and connection. So what is the pelvic floor? If you just imagine a hammock of muscles that stretch from your pubic bone in the front to the tailbone in the back, and from one hip to the other, that's pretty much our pelvic floor. It's a group of muscles and connective tissue that form the base of our pelvis. Well, what does it do? It supports our organs. It holds up that bladder, the uterus, the rectum. It controls our bodily functions. They help us to, urinate and such. And then they enhance our sexual function. So the pelvic floor plays a very big role in sexual sensation, arousal, and orgasm. Healthy muscles can increase pleasure and comfort during intimacy. Why does this matter? Well, when the pelvic floor is either too tight or too weak or not coordinating well, we can end up with pain during sex, urinary leakage or urgency, pelvic pressure or a heaviness, and difficulty with arousal and orgasm. So I think y'all have already gone over some of these conditions. So this will be just a quick review because I definitely want to focus on vaginal or uterine prolapse. But of course, vaginismus. Well, first I should probably say pelvic floor disorders occur when the muscles or the connective tissues of the pelvic area are weakened or are injured in some way. The muscles may not, when it's hypertonic, you can see it's tight. Hypotonic pelvic floor muscles are considered somewhat weak muscles. And so you've already had a presentation on vaginismus, dyspareunia, and probably a little bit on urinary incontinence. And those, at least vaginismus and dyspareunia, can sometimes be related to tight hypertonic pelvic floor muscles. So the pelvic floor muscles include the levator ani, coccygeus, striated urethral sphincters, and external anal sphincter. Any one of these muscles, or even a group of these muscles, may be involved in pelvic floor hypertonicity. This overactivity or tightening of this pelvic floor can result in, kind of what we call an altered activation or a reflex control, where our body just kind of contracts up. And, a psychosocial component can be that we experience anxiety when we feel this hypertonic issue. There is some evidence that heightened tonic activation may be linked to increased excitability of the central nervous system. So there's the fear of pain, anxiety, hypervigilance can lead to defensive behaviors, causing our pelvic floor muscles to contract. This can be a result of maybe a past trauma or past pain. And we have just kind of, from a psychosocial area view, it can cause us to be hypertonic. A lot of times, behavioral sex therapy, pelvic floor muscle training, even some medical treatment can help with this. There's no evidence-based protocol for medical treatment per se, but expert opinion has focused on muscle relaxants, botulinum toxin injections or Botox injections, neuromodulatory medications, including, tricyclic antidepressants, serotonin, norepinephrine, gabapentin, have been used in situations to address pain. And then, of course, with regard to psychotherapy, individual-based cognitive therapy can help, or even couples cognitive behavioral therapy. Even mindfulness-based approaches have been shown to effectively reduce pain and improve sexual function in women that have vulvodynia, dyspareunia, or vaginismus. And if you remember, vaginismus is involuntary tightening of the pelvic floor muscles. Usually this is in response to attempted penetration, such as during sex, during a pelvic exam, or during tampon use. And it can even make penetration impossible, if not uncomfortable. It is often linked to anxiety, trauma, or fear, but it can occur without cause at all. And this is the situation that Botox can help with vaginismus. Dyspareunia is really persistent or recurrent pain during or after sexual intercourse. It can be felt at the opening to the vagina or even deeper in the pelvic area. It can be a sharp pain. It can be an ache. It can be a cramp. It can be burning. It can result from physical issues such as pelvic floor dysfunction, infections, or emotional factors. And urinary incontinence is the loss of control over our bladder But we can also have accidental bowel leakage, where we have accidental loss of bowel function at times as well. With urinary incontinence, there's a lot of different types of urinary leakage, but the stress incontinence, which is leakage when we cough or laugh or sneeze or exercise, it is when there's an increase in abdominal pressure, which puts pressure on our weak pelvic floor, which we see in women with prolapse, and that can result in some accidental urine leakage. So then we get to that pelvic organ prolapse. It happens when those muscles or tissues supporting the pelvic organs, like the bladder, the uterus, the rectum, they become weak or stressed, causing one or more of those organs to drop from their normal position. This can lead to a feeling of pressure or bulging in the vaginal area, difficulty with urination. Some women whose bladders are dropping a little bit in the visceral area can struggle to empty their bladder. Pelvic organ prolapse is estimated to affect about 3% of women over age 20 and older, with prevalence and cumulative risk of pelvic organ prolapse surgery increasing as we women age. The effect of pelvic organ prolapse on sexual function is really complex, with many dependent factors, including our perceived body image. When we have pelvic organ prolapse, the pelvic floor is weak, and so the organs will drop down into and sometimes outside the vagina. And so this can affect our body image. We also, if we have urinary leakage, there is the fear of leakage in the middle of intercourse, which can increase our anxiety and affect our sexual health, loss of libido, concerns about partner satisfaction, discomfort secondary to reduced genital sensation. So in other words, pelvic organ prolapse negative impact on sexual function is related both to anatomical and psychological factors. Women may even report feeling a vaginal looseness, reduced vaginal lubrication, pain with intercourse or dyspareunia, vaginal winds, difficulties with vaginal intercourse due to this prolapsed or even a shortened vagina if they have had previous pelvic surgery. I want to share with you that there is a device called a pessary, which does improve sexual function, and surgery shown to change women from non-sexually active to sexually active after surgery. So women that have significant prolapse, in other words, may stop having intercourse because of a lot of reasons, psychological reasons versus physical reasons. And, there is research that has shown that surgery can improve sexual function. So with regard to pelvic floor muscle training, there's no definitive data to suggest that women who undergo this therapy for pelvic organ prolapse will experience significant improvement in sexual function. Although women, or this research or the research out there, has shown that there is an increase in pelvic floor control, pelvic floor strength, a person's awareness of their pelvic floor, improved confidence, a sensation of a tighter vagina, improved libido and orgasm, and resolution of pain with intercourse, and heightened sexual gratification for partners. So keep in mind that pelvic floor muscle training, there's no definitive data that doing pelvic floor therapy for pelvic organ prolapse will improve significantly sexual function, but there are small numbers that report an improvement. Okay. So remember in the earlier section, I brought up that our pelvic floor, if we could look at it like a hammock, when those pelvic muscles, the fascia, the ligaments, they're supporting like a hammock, the bladder, the uterus. And the problem is that hammock loses its ability to provide that support. And as a result, the visceral organs, which are our bladder, uterus, etc., will descend into the vagina. Sometimes, it will descend in the vagina, but not necessarily come out, but it can affect a woman's sexual health. So the impact on intimacy and pleasure. The physical barriers that women experience with pelvic organ prolapse, some women report pain with intercourse, which again we call dyspareunia, difficulty with arousal or orgasm because there's reduced sensitivity because of the laxicity of the pelvic floor. And what happens is when that pelvic floor stretches and weakens, it can impede blood flow to the pelvic region, which reduces, a woman's sensitivity. It can delay their arousal. It may even affect their orgasm and overall pleasure. Incontinence during intimacy is another issue. If there's a fear of leakage during intercourse, that can lead to anxiety and avoidance of sexual activity. Incontinence itself can cause women discomfort and dryness, which may make penetration difficult and will reduce a woman's sexual desire. And then reduced sensitivity. Of course, pelvic organ prolapse can impede that blood flow to the pelvic region, reducing that sensitivity. So as women, what should we watch for? Because remember, sometimes we can have pelvic organ prolapse, but it's not outside the vagina yet. So we're not really sure, or we may not know that it's actually there. But of course, if you have pain with urination, but it's not caused from infection, if you have discomfort or pain with intercourse, if you have pain during the initiation of intercourse, more than likely that's going to be vaginismus because it's hard for those patients to relax their pelvic floor muscle. But sometimes it can be related to urinary incontinence, which can dry and make introital entry or vaginal entry uncomfortable. Pressure, pelvic floor pressure, feeling of pressure or maybe a building up in the vagina or rectum, difficulty engaging your pelvic floor muscles. So believe it or not, a lot of times women think they are squeezing their pelvic floor muscles when they're actually pushing or doing what we call a Valsalva, and they don't realize it. I will say that pelvic floor muscle exercises will help women to, especially those with pelvic prolapse, it will help them to find and identify those pelvic floor muscles and to learn how to contract those muscles optimally. But remember, it's not going to reduce that weakness of the pelvic floor overall, or even to the point where the prolapse is corrected with pelvic floor exercises. When to seek help? We encourage early intervention, because that will really help women to, number one, realize you're not alone. Number two, realize there are options out there for you. And to, really and truly, it is important that you realize that you are not alone. Also remember that symptoms to watch for are the leakage, accidental urine and accidental bowel leakage. So of course, treatment, there's the holistic treatment, holistic healing, pelvic floor physical therapy. I think you had a physical therapist that came and spoke with you about what to expect probably at a physical therapy appointment. But it's usually a respectful setting. You have a private room. Your therapist will provide, comfort, consent, and clear communication throughout the session. They're going to collect a detailed medical history. The session will involve a conversation about your symptoms, your medical history, lifestyles, your goals. You may even be asked about your bladder, bowel, sexual function, childbirth history, etc. Then they're going to do an exam, and they're going to assess your posture, more than likely, your spine, your hips, your abdomen, and they're going to assess pelvic alignment. They're going to check to see if your pelvic muscles are tight or if there's any tenderness or any imbalances in the surrounding muscle groups, and in areas like the lower back or even your hips. They're going to do that internal pelvic floor assessment with, of course, consent. She'll do an internal exam and will assess that tightness or weakness, your ability to coordinate, squeezing your pelvic floor muscles. If you're having pain, they will look to see if they can find those areas that are triggering that pain. It could be a particular muscle or, a connective tissue or something. And then, of course, education and feedback. You'll receive that real-time feedback about what's happening in your body with pelvic floor therapy. Your personalized treatment plan, depending on the cause of your pelvic floor dysfunction, and of course, emotional support. There is also mind-body practices such as mindfulness meditation, breath work. Body scanning is really important to help you identify and find those areas that, making sure that you're relaxing all those areas. All of these practices will help us as women reconnect our bodies and reduce that fight or flight response that can worsen any type of pelvic tension that we have. And then there are the integrative approaches. And this means treating us as a whole person, not just our symptoms, not just, pain with sex, but, combining physical therapy with nutrition, combining physical therapy with movement, with emotional support, with lifestyle design. We can create a healing environment that helps support long-term pelvic health and our overall well-being. So there are, anti-inflammatory foods that can help reduce pelvic pain and inflammation, such as those leafy greens, berries, turmeric, omega-3s. Hydration is definitely essential for healthy tissue. And remember, our pelvic floor is made up of tissue. And then fiber-rich foods can help support our regular bowel function. It can help us reduce straining, which can affect our prolapse. And it can help us it just helps protect our pelvic floor to have fiber-rich foods in our diet, such as whole grains, fruits, and vegetables. And then if you are one that has urinary incontinence, I know I mentioned stress incontinence earlier, and that is when we leak with coughing, sneezing, bending, moving. Sometimes when we have prolapse, we can also have what we call urge incontinence. And this is when we leak, we have an urge to go to the restroom, but before we can get there, we'll accidentally leak. There are bladder irritants that can predispose us to have those urge kind of symptoms or even leakage, such as caffeine, alcohol, spicy foods, and sweeteners. All of those can be irritants that can affect urge incontinence. Movement, rebuilding our strength and coordination is important. Pilates, walking, yoga, it'll help us improve our posture, our core stability, and our pelvic floor coordination. We want to avoid high impact or straining type of exercises until, it's been cleared by your provider that is helping you manage your pelvic prolapse, and possibly a pelvic floor therapist. So, and then what are the lifestyle changes that will support just our overall whole body healing? Stress management. Oh my gosh. I wonder, does any of us not experience a little bit of stress almost every day in our life? Well, chronic stress can cause our pelvic floor muscles to stay tense. And then we don't realize it because that becomes our new normal, because we're walking around tensed all the time. And so that's why it's so important to participate in that mindfulness meditation or breath work or relaxation techniques to help make sure, that body scanning, is my pelvic floor tight? Sleep hygiene is important. It supports tissue repair and hormone balance to get adequate rest. Behavioral changes, avoiding prolonged sitting, lifting properly, trying not to lift, heavy things without those good body mechanics, trying not to delay those bathroom trips because, that can, produce strain on your pelvic floor. And then body awareness practices, just helping you to connect with your pelvic sensations, help you improve muscle control. That's where physical therapy can help you to identify those muscles and help you to know whether you are contracting or relaxing, or really contracting those muscles. And then, I don't want you to forget to include your partner, partnering together. It is so important, for connection. We really need communication. Their involvement matters because number one, it'll break that silence. It encourages open conversations about our pelvic health to our partner, and maybe they'll open up. I don't think it has been my experience in caring for women with prolapse that men tend to not talk much or share a lot with their partner who has prolapse because they do not want their partner to feel any guilt or anything like that from having a pelvic floor dysfunction. So that it's very hard for them to share, but I will share with you that when we do have pelvic prolapse, that can affect our introital opening or our vaginal opening. All of that can become lax, and that can affect emotional intimacy, relationship dynamics, and so speaking to your partner and speaking to your provider, physical therapist, those reduce feelings of isolation, because you will hear that you are not alone, okay? It will improve communication and support for us as women. It will foster shared understanding about the physical challenges of being intimate when we have prolapse, or even the emotional challenges that we have when we are living with prolapse. It can enhance sexual and relational satisfaction over time because we are real and we are there for each other. So again, I want to encourage open communication, making sure that it's honest, that boasts all people talking are non-judgmental in their conversations, sharing symptoms and how they affect daily life and our intimacy. The emotional responses, like getting frustrated with intercourse, maybe because we have decreased sensation, hard to have that orgasm, it's taking longer, it's exhausting. Fear of I'm going to have an accidental urine leakage in the middle, or even grief, knowing that our body is not like it used to be. What feels supportive versus overwhelming. Just discussing our concerns and our preferences with our partner honestly can alleviate anxiety and improve intimacy. Sometimes we have to change positions for intercourse, that kind of stuff, using those I statements. I feel anxious when, or I'm worried that this is going to happen, or, and for both couples to share that and to share those I statements really opens the door for communication. And then support, for, our healing, encourage consistency with exercises or therapy if we're participating in that, supporting each other in like for women in their relaxation and breathing practices, being patient and flexible with changes in our intimacy and in our physical activity, and celebrating those small wins like progress with exercises, reduced pain with introital entry or with vaginal entry, can help both partners feel hopeful and connected, especially if they understand what the patient is experiencing during intimacy. And also remember, there's other ways to rebuild intimacy as well. Pelvic disc floor function, it can affect sexual activity, but remember, intimacy is more than intercourse. We can explore non-sensual forms of closeness, touching, cuddling, emotional bonding. Practice sexual assertiveness, openly discussing that feels good, that does not feel good. That helps us to feel emotionally safe when we are talking about actual intercourse. And then, of course, it's important to respect boundaries and autonomy. While support is vital, patients need to feel in control of their healing journeys. So partners should ask, how can I help you? Rather than just assume you know what they want. Respect when space or privacy is needed. Avoid pressuring physical intimacy or rushing physical intimacy. And then, of course, educate together. We partners can benefit from learning about pelvic floor anatomy and function. Our partners can benefit from the nature of the dysfunction. Is the nature of our pelvic floor dysfunction pain because our pelvic floor muscles are hypertonic? Could it be urinary incontinence that may not be related to our pelvic floor per se, but maybe towards our bladder itself? Or could it be pelvic organ prolapse, which causes laxicity, which can affect our partner as well as ourselves? And what therapy involves and how it can support healing. And what other options are supportive for prolapse? And I really didn't bring up surgery per se, but the majority of women that have pelvic organ prolapse, the options are, and you know what? I had slides for prolapse, but I don't have them in here. So this must not be my updated slide deck, guys. Please forgive me. But I will say that women, you can have different parts of your pelvic floor that comes down and out of the vagina. And usually, women start having some pelvic prolapse, sometimes in our 30s, but it's in the vagina, so we don't really realize it. However, when it starts to come outside the vagina, then, we recommend treatment, whether it is wearing a device such as a pessary, which I had pictures of pessaries on my other slide deck, or surgery. And so I will say, I'll reiterate the research out there, but women that stopped intimacy with their partner because of their prolapse, for whatever reason, whether it was body image, whether it was discomfort, whatever the reason, when they had repair, women that were not sexually active became sexually active again. And so I want to stress that there is surgery out there as well. I'm not a surgeon, so I didn't really want to go over all the surgical options out there. Last, I just wanted to share, some national organizations that you can look up information more on pelvic organ prolapse and other pelvic floor dysfunctions that are out there. I wanted to share one thing with you. These are some of the websites as well for sexual dysfunction. ISWISH is the International Society for the Study of Women's Sexual Health. ISSM is the International Society for Sexual Medicine. And then there's the Sexual Medicine Society of North America. And then I wanted to end by sharing this article that I found, and it was apps. And, I am all about trying to use what's out there to help us. And there was a research study in 2023. I'm going to tear up this author's name, Dumaniskaya et al. He and or she and her colleagues, they actually reviewed existing apps on female sexual health to evaluate their educational content and services. And of the ones, let me see, they searched the internet and the Apple App Store using multiple keywords. There was a panel of physicians that specialized in the treatment of female sexual dysfunction, and they reviewed those apps for content quality, scientific basis of the provided information, usability, interactivity, and whether they would recommend it as a reference tool for patients. Of the 204 apps that were identified, 17 met the inclusion of their for their study. The selected apps were organized into groups based on, was it educational app? Was it an emotion and a communication app? Was it a relaxation, a meditation, general sexual health? And all of those 17 apps that they looked at, let me just make sure I've got most apps, which just give me 1 second. When we they were scored 1, 2, 3, 4, 5, and there were only 5 apps out of those 17 that scored a 4 or a 5, which is the higher the score, 5 being the best. Those were, that's how it was scored. I was trying to figure out 17 were included, but only 5. I'm only reporting on 5, but that's because I wanted to report on the ones that were worth it. And so I wanted to let you know that Lover is one that got a score of 4. And Rosie got the score of 5 out of 5. And Rosie, Furley, M Joy got 4, and Rosie got 5. So I wanted to let you know that there are some apps out there that can help you, and help with really connection with your partner, and understanding your sexual health. So digital technology, could be an effective way to overcome barriers to assessing information and ultimately care for female sexual health. So now I'm ready for questions, I think. Do y'all have any questions for me?
All right. So there we go. Thanks for Dr. Lisa Pear taking over and helping out a bit with this. And I think I just got Lori here. I got to bring her in there. Lori, hey, welcome to the show.
Hi, sorry for the technical difficulties this morning.
It happens. It started out with my getting a call from our speaker yesterday saying, I have to have an emergency procedure done. I can't be there.
Oh, no.
So I'm like, okay, well, no problem. I've got something pretty close to that I did with Jeff on his show. So, but you guys are welcome to put questions. I see we got a fair number of people watching live. I did see one come in here from Katie. Hopefully this answered your questions. Katie stated she had a hysterectomy and a sling procedure in July and wants to know what exercises she can and cannot do. Probably was hoping to have the physical therapist who was supposed to be on to answer some of those. But in general, I don't know, Lori, do you have any thoughts? I know that we have a Euro reconstructive surgeon that I worked with, and we would have people, once they healed from their surgery, of course, 6 to 8 weeks down the line, going back doing things like pelvic floor exercises. I think Lisa Parrott mentions those things too. You have any other thoughts? Or
Yeah, that's exactly what I was going to say. The pelvic floor exercises are always number one. Even though you think they're not working, they probably are.
And there's I'm going to put let's see here. I got a banner up here for Dr. Jeff Albaugh's show, drjeffsextalk.com. You can check that out. Because she had mentioned things like Pilates and yoga and things like that. And those things are also being used now. There's been a few instructors that are yoga, even acupuncturists that have been on Jeff's show. And so you can go back and watch some of those episodes because they're all there, and look into some of those, Katie, because I think there's anything out there that you do is probably going to be helpful. All right. Any other questions coming in? Nope. Some comments from some of the audience, but I don't see any questions. If you do have any comments or questions, feel free to put them in. But yeah, I think that this is an area that we're going to definitely push to have her come back on when she's feeling better. I did send her a quick note that let me know when you're able, and so we'll bring her on in the future. So you all set for Christmas?
No, I never am. I'm literally last minute Lori. That's what I call myself, because I've got things from Amazon that haven't arrived yet, and it's getting a little nerve wracking. So how about you?
Yeah. Well, I do it. I take it the easy way out. I just write checks. It always fits, it's the right color. So yeah, I'm pretty ready. But I will give you a quick Amazon story. So we are, we're out in Florida right now, staying in one of these rentals things. And I wanted to order something on Amazon. So I did. And it doesn't come. And I get this message, undeliverable. Well, I remember I asked the guy that we rented from, can I have my mail forwarded? Because we're going to be here for over a month. And he said, no. He said, we don't get any U.S. Postal Service. And that's how they were trying to deliver.
Oh,
now,
no.
I have a connection from Amazon. My son works there. So, of course, my wife gets on the line and she's complaining to him. He goes, just relax. He goes, call Amazon and tell them what happened. And they have to deprioritize your house for USPS. So I didn't even know what that meant, because they can't send it over the United Postal Service. They have to send it with one of their trucks or FedEx. He said, he says, basically Amazon will find their system will figure out what's the cheapest way to send it and utilize that. But they can send it other ways. So problem solved. If you can't get a delivery because you're staying at a Vrbo or a Airbnb because they don't get mail service, just call your Amazon. They're friendly as could be. Her name was Kiki. I give her some credit for that. She was really helpful. And we've already had 2 deliveries come, so I know it works.
Oh, good. I'm only waiting on a couple of stuffed animals. Can you believe that? They haven't even been shipped yet. They were supposed to be here by now. And I'm like, they're stuffed animals.
Oh, I mean, they've got to be crazy busy because of all the stuff that they're trying to get. But then I got my daughter's coming in for the holidays too, and she's driving in from Chicago. And she said, "Oh, by the way, Dad, I had the diapers for the baby shipped over there too." I says, "By Amazon?" She says, "Yes." I says, "I hope I get them." Well, they just came.
Oh, that's good.
So it's working like a charm.
Good.
All righty. Well, I don't see any other questions coming in. I'm good with calling it a day. So let me put a little promo for next week's talk.
Welcome to the Christmas and New Year special on Euronurse, hosted by Vixenie. As he wraps up the year and looks forward to a fresh start, this episode highlights the most important new advancements in urology. Giving clinicians, patients, and caregivers a clear snapshot of what's coming next year. Join us on December 27th at 9 a.m. Central Time to learn more. You're a nurse.
All right. This is one of my favorite shows to do, where I just kind of go through the research and see what's coming up, what's going to be new on the horizon. So I've got a bunch of things that are out there. So hopefully you'll be able to join us, Lori. I don't know what your schedule looks like. You did get a question. Oh, no,
it was for me.
Answer it.
They weren't jelly cats. They were just little border. I get this specific. They had to have a specific type of dog stuffed animals. So these border collies I'm waiting for.
Okay. See, we're helpful for everybody.
I know.
So anyway, back to, I hope you can join us next week, because it's going to be a fun episode. If not, check it out, because it's always fun to look at what things are coming up in urology. It's always something new, some exciting stuff. So we'll be doing that next week. Otherwise, hey, everybody, have yourself a merry little Christmas, and we'll see everybody next week on Euronurse.
Happy holidays, everyone.
So here's to